Start at stomach 41, and then from down you palpate across the top of the foot and then down the liver line. And this is where I'm diagnosing as well, because I'm looking for which of those intertarsal lines has the most sensitivity. Okay, so in the Thai method, stomach 41, palpate across the top of the foot, down through the liver points, and then back to stomach 41, and then palpate from there, and then down the stomach meridian between the second and third metatarsals, back to stomach 41, palpate across the top of the foot between the third and fourth, back to stomach 41, gallbladder line, back to 41, and then you can palpate bladder line there. Okay, so I went through that kind of quick. It's a little different explaining it and palpating it at the same time, but you know, when you're with a client, you're bringing full awareness to this, checking in with them. One thing I want to say just about this to finish some of it is that if you look closely at these points, liver 2, liver 3, and the functions, these interosseous muscles between the metatarsals, they're on the deep front line, and they have a very similar function. If we're speaking about imaging, the feet image the head, right? I like these points for sinus problems. I've had just tremendous success. You've probably seen that too, right? Have you used them much for sinus? Facial conditions, headaches, food allergies. Like someone here I was friends with was very allergic to food, gluten and dairy and stuff. And I did 66.05, and to stop, like, they would have diarrhea and stomach pain really bad when they ate something, some gluten slipped in somewhere, and I did that point, and she would be sick for days, like if she ate something that she was allergic to. Like, I used 66.05 at the junction between the second and third metatarsals. That point 66.05 on the stomach line. I use that with one more. I like to do sets of 2 of them there on that same line, and that like stopped that food allergy reaction that she has. I was amazed by that. That really, I had used them for years before that, but knowing her level of sensitivity and reactivity, if she had foods that she was allergic to, I was totally surprised at how effective it was for stopping that. So think of these lines here, and certainly in the tongue system, I've also used them for allergic rhinitis and an assortment of different sinus conditions. And the technique, if you don't know this, is to use 4 to 6 points, depending on the client. And you're going to want to do, like, you can do 2 in the liver line, 2 in the stomach line, and 2 in the gallbladder line. Or you can do liver line and gallbladder line, 2 points. So you do like GB 41 and 42, or you're going to want to palpate, right? And this is the value of this palpation technique, is to start at stomach 41 and then palpate down each of those, rather than just putting 6 needles in like a really hypersensitive person, right? Just, you might even be able to get away with 2 or 3 points for a hypersensitive person. You know, for your average person, I'll do at least 4. Another person I treated here in group acupuncture, one time I used to do group acupuncture at the Tea Temple, and I had to be real quick because I'd only do it for 2 hours, but people would come in and I would often see like 8 people really fast. They'd just come in, and that was where I could really practice the tongue system, is in group acupuncture. You know, in other places too, I practiced it, but I would have a system where I just have them list their top 3 health concerns. I look at that. From that, I have enough information, and then I just put 3 points in to start, and then I can go to the next client. So if you want a high-volume clinic and you're trying to see more clients, set up group acupuncture, community acupuncture, at least twice a week or 3 times a week during your busy office hours. When everyone wants to come in, You put them all in group acupuncture, and then you just do these quick methods. And this is where I really mastered these techniques. One client I saw, I was surprised by this. She was living in China, and her main complaint was sinus problems due to the pollution. And she was a frequent customer here. She would come here frequently from China because she wanted out of that, right? And so I got to follow up with her through some time, and just doing these points on the feet, and I probably did Lingu as well, but just doing those points, 4 to 6 needles through there, it was able to resolve the respiratory problems he had, even though there was that strong environmental factor from living in Shanghai, you know. So you can use them for all kinds of respiratory, and especially when it's like a Xiaoyang and Yangming, right? Let's talk about treating the feet. And this was the thing that turned me on to the Master Tong system. I've probably shared it with you all, but it was such a miraculous and amazing case history. I was treating an older lady. She was in her 70s at the time. I'd been seeing her for quite some time. It was maybe even a couple months in. She asked if I could do something for her husband who had bone spurs in his heel. They were incredibly painful. He couldn't walk. I didn't know what to do from a TCM perspective. I just recently bought the book, Acupuncture 1, 2, 3, or one of those short, simple pawn books. And it said to use Muguan and Guguan on the base of the palm, right? So I thought, well, what am I going to lose? I'll try this, right? I did those 2 points, and maybe I did something else. Maybe not. I may have just done that. And he was 77 or something. And the pain was gone. They were talking about doing surgery. They didn't want to do that because he's 77, but what do? He's in so much pain. Acupuncture. Okay. Fingers crossed. I hope this works because, you know, she was a really nice old lady and a long-term client at this point. And I did those points. He came in for a follow-up. The pain was gone. Second time we did it. Pain was gone. She continued to come in because I was treating her for arthritis, and you know, it was difficult. She had a lot of pain, but I was able to like meet him and, you know, follow up for months. It wasn't like he just came in and then disappeared. I was able to meet him in the office and talk to his wife, and still after 6 months the pain has never returned. And I mean, that just I can't comprehend how that can work with bone spurs, right? But that's the beauty of the Tong system, is you get like these incredible results with just 2 points. Okay, so back to hand points. You okay laying there? Yeah. If you want to get up, we can probably find another model, but we're getting to some good foot massage techniques, so hang tight. Okay, so some point combinations you can do for the feet. You can use that Lingu, Da Bai, Sha Bai combination. You can use that for feet, right? Because the hands image or mirror the feet. Okay, so if he has a problem over here on the left foot, I'm first going to do the opposite hand, right? If it's in the liver line, I can definitely do the large intestine points and Lingu. If it's in the gallbladder line, then that we got 22.06 and 22.07 over here that we can use if we're sticking with the meridians. I like this combination. One thing I've discovered was that rather than Lingu, Da Bai, and Sha Bai, you can do Sha Bai and Yao Tong Shui. I'm always thinking, how can I use less points and get better results? I've found that using these 2 points, Yao Tong Shui, between the second and third, and at the base, at the proximal end of it, and then those 2 points work essentially the same as Lingu, Da Bai, Sha Bai, but one less needle. And if you're doing,
I do the same.
Do you?
Yeah.
Yeah, you found the same?
Yeah. It's in the Japanese model as well.
Oh, is it?
Yeah.
Oh, I didn't know it was a Japanese thing too.
Yeah.
That's a great method. So you can use that for treating the opposite foot too, just those 2 points. Okay, now when you do that, let's cover some of our basic joint movements first. So dorsiflex and plantarflex. I'll have my clients do that. I'll tell them, you know, I don't say dorsiflex, right? Pull your toes towards your head and then extend them out. And then I'll ask them to breathe as well. So inhale and pull your toes towards you. Exhale and then point them out. So now we're starting to work with the articulations here and the ankle and the foot. We're getting that movement that's so necessary. Okay. Now, if you want to add some manual therapies to this, where's that chair? A nice simple place to start is you've got and where you can continue your assessment. Put your hand points in, go to the opposite affected foot, start at kidney 1. This is a Thai massage technique too, super simple. Start at kidney 1